this afternoon, and over to South Australia we go. South Australians can now access instant and authoritative answers to their COVID-19 queries thanks to a virtual agent developed by Adelaide-based tech company Clevertar and SA Health. The virtual agent, dubbed Zoe, can answer a range of common COVID-19 questions and help find the information they need through guided conversation. To tell us more is Tanya Newstart. Hello, Tanya.
G'day, Alana. How are you?
Very well, thanks for joining us. Now, this is a fantastic use of technology. Just explain to us exactly what is a virtual agent and how does Zoe help answer our questions?
Sure. Well, a virtual agent is sometimes called a virtual human or a chatbot. Essentially, it's a bot that you can hold a conversation with. So, in that way, it's more like having a conversation with someone to give you a hand rather than reading, FAQs and things that can be quite difficult to get your head around.
So, how did South Australian Health create Zoe? What was the process and how much time went into that?
Yeah, well, that's a great question. So South Australian Health, or SA Health, had quite a lot of information already. They had flow charts, they had a lot of web pages, so they had the information already. And what we did is help them by putting it into what we call a dialogue tree. So putting it into a conversational platform, which is the Clevertar platform. And that really can take a very short time. In fact, in their case, it only took a few days to put together for this first iteration. And we're planning to build that out actually over the coming weeks.
So how does Zoe alleviate pressure on the health system?
Right. Well, a lot of the questions that consumers ask about COVID-19 are really quite similar. They, if one person has a question, probably someone else does as well. So it's a kind of the 80-20 rule. So what a conversational agent, a virtual agent like Zoe can do is really take a load by answering all of those standard questions. And that means that the contact centre is available for health workers or for more complex queries. And so that's how she really helps with the health system.
Now, I'm sure we've all been on a couple of these websites where they do have these kind of chatbots and you're trying to communicate with them and you get frustrated and you just want them to be able to understand you. So what makes communicating with Zoe a more enjoyable experience compared to that standard chatbot?
Yeah, well, there's a couple of things. One of the first things actually is that Zoe has a face and a voice. So, you don't feel like you're just talking to a bot. You feel like you're actually talking to something that's a little bit more human, a little bit more relatable. And the second way is that Zoe asks you questions. So Zoe helps you define what your problem is and then take you to a solution. And in that way, it's a little bit different to other chatbots. Although we certainly do have the capability for natural language understanding as well. But in this case, and right now, Zoe is the one that leads the conversation.
So how does this all work on the back end? If you had a team of doctors and nurses answering potential questions and then recording that, how does it all work?
Yeah, actually, in this case, SA Health already had the content that they wanted to deliver. So they have, for example, they have a testing flowchart that says who should be tested for COVID-19 within South Australia. Probably all the states have this. And so they were just simply able to supply that to us, and then we could convert that into a conversation with our virtual agents, or with Zoe in this case. But our platform makes it so that actually they will be able to do it themselves as well with just a bit of support from us.
Fantastic. And what's the feedback been like? Have you had some from people that have used the platform?
We have. A lot of times when people have their answers solved, when they get to where they want to go, they don't necessarily say thank you. But so far we've received some pretty positive feedback of the people who've left feedback. That it's been overwhelmingly positive, so we're really pleased.
And where to from here? Do you plan on using Zoe, I guess, post-COVID-19?
Certainly, we would like to recommend it. So SA Health will be carrying out an evaluation at the end of this period, which hopefully won't be too long, actually. But certainly, so far there's been quite a lot of interactions, many thousands of interactions with Zoe. So we'd like to see if there are greater possibilities for Zoe to help with not just COVID-19, but all kinds of health issues for South Australians.
Are you getting any interest from the other states? Have the other states looked to South Australia to go, oh, that's how they're handling it?
Well, we haven't had inquiries yet, but that's there's certainly every possibility. As I said earlier, we could do this development very quickly. So it's something we'd absolutely welcome.
Absolutely. Look, if people are in South Australia, how can they access Zoe? Where can they find her?
Just the SA Health website, and she's right there.
Oh, fantastic. Well, great use of technology, a wonderful initiative, and all the best.
Thanks so much, Alana.
Thank you.